Hello, my name is Dr. Drew Hall, and I'd like to briefly explain to you what upper cervical care is all about. The work that we do in the office, we deal with the atlas, which is that yellow bone right at the bottom of the skull, and the axis, which is the number 2 vertebra at the base of the skull. And in between those two vertebrae rests the brain stem. That's that red area you see right there. The brain stem is responsible for controlling cardiac function, respiratory function, the vasomotor nucleus, which controls blood pressure. So basically your brain stem is the most vital part of the nervous system, and it controls and coordinates most function in the body. Now, most people have been in a car accident, a sports injury. I personally was dropped upside down on my head. Those types of traumas can cause this 2-ounce vertebra right here at the base of the skull to displace and get locked out of position. If that vertebra becomes locked out of position, it throws the head off center, and that puts stress on the brainstem and creates an interference to function in the body. Now, most people know this, but your brain basically is the generator of nerve impulse through the whole system, and I always tell patients that every single cell in your body is controlled by a message from the brain through the spinal cord out the nerve to the tissue. And so if that vertebra becomes locked and it creates an interference, it can affect any function through the whole system. So we do not treat diseases and symptoms in our office. I always tell patients that diseases and symptoms are the end result of dysfunction in the body. Our job in our office is to correct this structural problem here, to get the atlas back in its normal position, get the head back up on top of the neck, remove the stress off the spinal cord so your body can function the way it's supposed to. And one more thing, the way that we determine how the atlas is dislodged under the skull is by looking at how the joints fit together. Every joint in your body fits together like a mirror image, basically like two halves of a peanut. And if we can image how the number 1 vertebra fits to the floor of the skull, we can see how those two joints match together. Are they even? Has it shifted off the floor of the skull this way, or is it shifted under this way? And that allows us to see exactly what direction that vertebra is out of position. And the reason I tell you this is I want you to understand that we do not take people's head and twist or pop or pull it. It's a very precise, light correction into the neck to get that vertebra back where it belongs. So we'd love to see you in the office. We offer a free consultation and exam. Hope to see you soon.